I'm Islin and I will present introduction about X-ray machine. An X-ray machine is a device that uses X-ray for a variety of applications including medic, X-ray fluorescence, electronic assembly inspection, and measurement of material thickness in manufacturing operation. In medical application, X-ray machines are used by radiographers to acquire X-ray image of the internal structure of the living organism and also in sterilization. X-rays are a form of electromagnetic radiation similar to visible light. However, X-rays have a higher energy and can pass through most objects, including the body. Medical X-rays are used to generate image of the tissue and structure inside the body. If X-ray pass through an X-ray detector and the other side of the patient, an image will be formed that represents the shadow formed by the object inside the body. The significance of X-ray machine, of course, for diagnosis. First, X-ray radiography detects bone fracture, curtain tumors, and other abnormal masses, pneumonia, some types of injuries, clavication, foreign object, or dental problem. Second, mammography, a radiograph of the breast that used for cancer detection and diagnosis. Tumors tend to appear as regular or irregular shaped masses that are somewhat brighter than the background of the radiograph. Third, compute tomography, or we call as CT. Combines traditional X-ray technology with a computer processing to generate a series of cross-sectional images of the body that can later be combined to form 3D X-ray image. CT images are more detailed than the plain radiograph and give doctor the ability to view the structure within the body from many different angles. Last but not least is fluoroscopy. Uses X-ray and fluorescence screen to obtain real-time image of movement within the body to view the diagnosis process. For example, fluoroscopy is used to view the movement of the beating heart and the view blood flow to the heart muscle as well as through blood vessel and organ.
Hi, my name is Nurul Farhana and I will continue with the second part, which is scientific instrumentation and application for X-ray machine. So, we will go with scientific instrumentation first. There is 4 things we can see, which is X-ray tube, digital X-ray imaging, control console, and cooling system. Let's go one by one. First, X-ray tube. It is a vacuum tube that converts electron to the X-ray. How is it working? Cathode filament inside the tube will heated up by a low voltage current of a few ampere, then the electron will start breaking free. Lastly, the electron will attracted to the anode disc. Second one is digital X-ray imaging. The function is to capture the X-ray image using planar array of electronic sensors where electrical detector will generate signals and the output will be displayed in grayscale image. The third one is control console. It is functioning and adjusted the tube voltage, tube ampere, and the exposure time. It also have an on-off switch for the current flow and allow the radiologic technologies to control manually. For the information, it is one of the important equipment for the X-ray machines. Lastly, we have cooling system. It have an energy that transforms into heat at anode focal point. The function is for cooling the tubes of anode using water or oil recirculating system and to prevent the cathode tube from burning. So, there are so many applications for the X-ray machines, but we will explore more detail about just 2 of it, which is medical application and security screening. The first one is medical application, or we can call as radiography. It is the most basic form of medical imaging, quick and painless process. In this application, X-ray machines is used for producing an image of body internal structure using a very small dose of ionizing radiation, or some of it may use iodine-based or barium to help improve the visibility of the image. To do the X-ray examination, there are rules and procedure we need to follow, which is make an appointment and submit request to do this examination so as doctor can analyze if you really need this examination or not. Second one is inform to the doctor if you are pregnant to protect your babies. Then make sure there is no metal or any jewelry and hold your breath when X-ray exposure is being made so as there is no any movement in the image display. This application is often used for diagnosis and injury or infection of bone, tissue, and other organs. You can do X-ray examination for your medical checkup also. Lastly, example of body part that always been examined is spine, skull, lower limbs, pelvis, chest, and facial bones. Let's move to the second application, which is security screening. If you're always traveling, you will always find the machines at the airport to scan your luggage, bag, or maybe parcel, and this is an efficient solution for the airport security. How the X-ray machines can see what is inside the bag? It is because inside that have an X-ray tube from different angle to irradiate your luggage. These machines comes with different size and look with different kind of uses such as high scan and PX series. In this modern generation, people come out with the new features in this technology where the output image already in specific color such as yellow, blue, and green to make it easier for detecting prohibited items. Not only that, the machines need to be handled by someone who is already have an appropriate training so as they know how to act if there is an emergency with the machines. Besides that, it is completely harmless because the design of the installation does not allow the penetration of rays outside the body. How the X-ray work? First, the things will irradiated with X-ray tube, then directional X-ray beam is scattered and radiation energy will be lost. The leftover energy will convert into electrical signals. Lastly, they will process and display into X-ray image. What is the use of this security screening? It is to scanning and check what is inside the bag or parcel to avoid dangerous items, avoid weapons, and explosive things. This application also can secure the security at the airport. There are a few types of equipment such as portable small-size scanners, scanning X-ray baggage scanners, surface sensing, X-ray body scanners, and many more.
Assalamualaikum and hi, I'm Hanis and I'm going to talk about real-world implementation for X-ray machine. Alright, before we dive into getting an X-ray machine, we need to understand why we need it. Are we using it for checking broken bones in a medical center or for studying materials in our science lab? Once we know what we need it for, we're going to check if it's even possible to get one. That's where feasibility comes in. We'll think about stuff like how much money it will cost us, where we're going to put it, because we don't want it squished in a corner. And we're going to make sure it follows all the safety rules like keeping us safe from radiation. Secondly, monitoring and evaluation. Once our X-ray machine is all set up and running smoothly, we're not just going to forget about it. We're going to keep a close eye on it to make sure it's doing its job right. We'll keep track of stuff like how often it's being used, if it's making any mistakes, and if it needs any fixing up. And every now and then, we'll do a big checkup to see how well it's doing overall. This way, we can make sure our machine is always in top shape and ready to help us out whenever we need it. Thirdly, procurement and installation. The procurement process will include evaluating different vendors, negotiating contracts, and ensuring that all equipment meets the required specifications. Once the equipment is acquired, the installation phase will commence. This will involve setting up the X-ray machine in the designated room according to the detailed plans. The installation process may require structural modifications to the room, such as adding or reinforcing walls for radiation shielding, installing the necessary electrical infrastructure to support the machine, and ensuring proper ventilation and cooling systems are in place to maintain optimal operating conditions. The installation will be carried out by trained professionals to ensure the machine is correctly and safely set up, ready for initial testing and calibration. Last but not least, maintenance and support. Alright, we've got our X-ray machine up and running, but the job's not over yet. Just like how we take care of our gadgets and toys, we gotta make sure our X-ray machine stays in tip-top shape. So we'll set up a schedule to check on it regularly, kinda like a doctor's checkup, but for machines. We clean it, fix any parts that need fixing, and make sure it's running smoothly. And if anything goes wrong, don't worry, we've got a team ready to swoop in and fix it up quick. So what is the potential benefits in using X-ray machine? First thing first, it is cost effective. X-ray machines may have significant upfront costs, but they offer substantial long-term cost savings within healthcare systems. By providing accurate and timely diagnosis, X-ray imaging helps avoid the need for more invasive or expensive diagnostic procedures. Additionally, it aids in preventing unnecessary treatments by enabling healthcare providers to precisely identify the underlying cause of a patient's condition. Over time, this cost-effective approach not only reduces healthcare expenditures but also enhances overall patient care and outcome. Secondly, quick and accurate. X-ray machines offer the advantage of providing quick and accurate diagnostic imaging. Patients can undergo X-ray scans relatively quickly with results available immediately or shortly thereafter. This rapid turnaround time enables healthcare providers to swiftly assess the patient's condition, make timely treatment decisions, and alleviate patient anxiety. Moreover, X-ray imaging yields detailed and precise images of the internal structures of the body, allowing for accurate diagnosis of various medical conditions, including fractures, infection, and abnormalities. This combination of speed and accuracy enhances patient care by expediting diagnosis and facilitating prompt initiation of appropriate treatment. Thirdly, versatility. X-ray machines are incredibly versatile diagnostic tools that find applications across a wide array of medical specialties. From radiology departments to orthopedic clinics, dental offices, and emergency rooms, these machines play a pivotal role in healthcare delivery. They are capable of producing detailed images of bones, joints, soft tissues, and organs, allowing healthcare providers to diagnose and monitor various medical conditions and injuries with precision. This versatility makes X-ray machines indispensable assets in modern healthcare settings, enabling comprehensive patient care across different medical disciplines. And last benefits would be guidance in procedures. X-ray machines serve as invaluable tools in providing guidance during medical procedures, whether it's guiding the placement of medical devices such as catheters or pacemakers, or assisting in surgical interventions. X-ray imaging offers real-time visualization and precise localization of anatomical structures. This guidance enhances the accuracy and safety of procedures, reducing the risk of complications and improving patient outcomes. Furthermore, X-ray machines play a crucial role in interventional radiology procedures where they help guide minimally invasive treatments such as angioplasty, biopsy, and drainage procedures. By providing during procedures, X-ray machines enable healthcare providers to perform interventions with greater confidence and efficiency, ultimately benefiting patient care. So, how about the challenges in using X-ray machine? First, health risks. While X-ray machines are useful for diagnosis, they use radiation, which can be harmful if not managed carefully. Exposure to too much radiation over time can increase the risk of health problems like cancer. To keep patients safe, healthcare providers follow strict safety rules like limiting exposure time and using protective shields. It's especially important to be cautious with pregnant women and children because they are more sensitive to radiation. Next, access and availability. Access to X-ray machines can vary depending on where you live and how much money you have. In big cities and wealthy areas, it's easier to find X-ray machines in hospitals and clinics. But in rural or poorer areas, they might not have them, making it harder for people to get the tests they need. To fix this, we need to make sure everyone, no matter where they live or how much money they have, can easily get access to X-ray machines when they need them. Last from me, technical expertise. Operating X-ray machines requires special know-how. Healthcare professionals like radiology technologists need training to use these machines safely and effectively. They learn how to position patients correctly, adjust machine settings for different types of scans, and follow safety protocols to protect themselves and patients from radiation. This expertise ensures that X-ray images are clear and accurate, helping doctors make the right diagnosis and treatment plans. Training programs and ongoing education are essential to maintain technical proficiency and ensure quality care for patients.
Hi, I'm Mim. I will continue for the next part, which is the future development and innovation. So we will go through for the first one, which is the development. I put the three ideas for the future development, which is the first one is AI integration, or we call it as the artificial intelligence, which is it is a revolution in security screening by rapidly analyzing X-ray image to detect contraband and threats more effectively. And it also will reduce the likelihood of human error and speed up the screening process and make it more efficient and reliable. For the second one is quantum X-ray imaging. By using the quantum detectors, it will enhance the sensitivity and efficiency of X-ray system used in security screening especially. This will result in higher quality image and lower radiation doses, and it also improving both an accuracy of threat detection and the safety of the screening process. And last but not least for this development feature is functional X-ray imaging, which is this future technology will move beyond structural imaging to include functional imaging capabilities, and it also can provide real-time insight into physiological processes like a blood flow, lung ventilation, and tissue perfusion, and it will offering a deeper understanding of various medical conditions. So for the next part, which is the innovation, I also put three ideas, which is the first one is high resolution imaging. By development in high resolution imaging using advanced materials such as lead-free antiperovskite nanocrystal, it will provide a clearer image with a better stability, this is crucial for various applications including medical diagnostic and industrial inspections. And for the second one is reduced radiation exposure. It's still ongoing research focuses on dose reduction technique and alternative imaging methods such as low dose X-ray or X-ray phase contrast imaging to decrease radiation exposure and enhance safety. And last but not least, for the future innovation in X-ray, which is the digital tomosynthesis. This technique allows the creation of 3D image from multiple X-ray projection taken at different angles. It improves the detection of structural abnormalities by reducing overlapping structures seen in traditional 2D X-ray. So that's all for the future development and innovation. We will move for the next part. Thank you.
In a nutshell, we can conclude X-ray machine has a lot of benefit from various ways that we can use for our life. This is because X-ray machine is cost effective, versatility, quick and accurate, and guidance in procedure. As we talked before, X-ray machine are invaluable tools in medic, providing non-invasive means to diagnose various conditions in our body. Besides, the ability to penetrate tissue and produce detailed image allow for accurate diagnosis and improve patient outcomes. However, X-ray machine is dangerous for body because the radiation exposure. That's all from us. Thank you.